Urinary incontinence is the involuntary loss of urine. In simple terms, it happens when you can't completely control your bladder, which leads to accidental leaks. This condition affects millions of people worldwide, including both men and women, and it can have a major impact on daily life, self-esteem, and confidence. Many people feel embarrassed to talk about it and don't seek help, but the truth is that urinary incontinence is treatable and should not be ignored. There are several types of urinary incontinence. The first is stress incontinence, which occurs when urine leaks during activities that put pressure on the bladder, such as coughing, sneezing, laughing, exercising, or lifting heavy objects. The second type is urge incontinence, which happens when you feel a sudden and intense need to urinate, often without enough time to reach the bathroom. The third type is mixed incontinence, which is a combination of stress and urge incontinence, and is the most common form among women over the age of 50. Finally, there is overflow incontinence, which occurs when the bladder doesn't empty completely, leading to constant dribbling or small, frequent leaks. The causes of urinary incontinence can vary depending on gender, age, and health conditions. In women, common causes include pregnancy and childbirth, menopause, hormonal changes, a weakened pelvic floor, and recurring urinary tract infections. In men, prostate problems, such as an enlarged prostate or complications after prostate surgeries, are common causes, especially with aging. There are also general factors that can affect both men and women, including diabetes, obesity, chronic constipation, the use of certain medications, and excessive consumption of caffeine or alcohol. Some risk factors increase the chances of developing urinary incontinence. These include being over the age of 40, having a family history of the condition, being overweight, and smoking. Smoking is especially harmful because chronic coughing can put extra pressure on the bladder and pelvic muscles. The most common symptoms of urinary incontinence include involuntary urine loss, frequent and urgent needs to urinate, needing to go to the bathroom more than 8 times during the day, waking up several times at night to urinate, and having a constant feeling that your bladder isn't completely empty after using the bathroom. You should seek medical help if urinary incontinence starts interfering with your daily activities, causes pain or discomfort, worsens over time, or if there is blood in your urine. It is also important to seek guidance if the condition is causing social embarrassment or impacting your quality of life. Treatment options will depend on the cause and severity of the problem. Conservative treatments include lifestyle changes, pelvic floor exercises such as Kegels, bladder training techniques, and pelvic physiotherapy. Medical treatments may involve specific medications, minimally invasive procedures, corrective surgeries, or specialized medical devices. The key is to get a proper diagnosis so the treatment can be tailored to your needs. There are also several ways to help prevent urinary incontinence. Maintaining a healthy weight, exercising regularly, and strengthening your pelvic floor muscles are some of the most effective steps. It's also important to avoid smoking, limit caffeine and alcohol consumption, and treat urinary infections as soon as they appear.
Remember, urinary incontinence is not a natural or unavoidable part of aging.
While it is more common as we get older, it's not something you have to live with. With the right care and treatment, you can regain control of your bladder and improve your quality of life. Don't feel embarrassed to talk about it. Seek medical guidance and take the first step toward a healthier and more confident you.